There we go. We are now recording. So welcome. So as I've said to you already, I'm Hayley. I'm the development worker for the peer community, and I'm employed by Health in Mind. I'm going to sort of do the first part of this presentation, and then Kat from Thrive will take over for the second part, which is more focused on Thrive. So first slide. So I just want to give you a bit of context for today before we sort of move on to introducing you to the peer community. Because before the peer community, and some of you may be very aware of this, there was the peer collaborative. So the peer collaborative was a network for peer workers in Edinburgh. It was part of the PSP. And it was there to bring together peers in Edinburgh to strengthen peer work. So to develop the understanding of what peer work is, to develop people's understanding of the peer work values, which were developed by the Scottish Recovery Network. There were workshops, there's a course, there's a qualification that people could do. We have practice development groups, there's a newsletter, there's social media. I really feel like, so the peer collaborative itself was like the peer community. It's all of you, it's all the people that have contributed to the events and the sort of information that's gone out over the sort of I think it's about 2.5 years that the peer collaborative existed. But also behind the scenes, there was the peer collaborative partnership, which was a partnership of organisations within the PSP working together to share information, to share good practice, and again, to strengthen peer work as best we could in Edinburgh. And that partnership was made up of Health in Mind, CAPS, NHS Lothian, Penumbra, SAMH, Bipolar Scotland, Cyrenians, Edinburgh Carers Council, Cargrom and Vocal. And in my opinion, and I don't think this is just my opinion, I feel like our main legacy from this period was a film called Side by Side, which is one of the workshops that some of you were going to a bit later, which is a film that was made by Media Education. And in that film, we approached peers who we felt represented the broad range of peer work and peer support that were taking place in the city to tell their stories and speak about why, what peer work means to them. It's a really powerful film. I'll send out a link to it in the sort of thank you for attending email, along with some other materials. So if you're not going to that workshop today, you'll have a chance to watch it if you haven't already. And I think that film is like such a valuable tool that we'll be continuing to use to increase the understanding of peer practice for people who are peer workers, and for people who work with peer workers, of people who are like wanting to attend a peer space or sort of be supported by a peer worker. So just in case this is something you're not aware of, so I've been saying the word peer work quite a lot, but for some of you, you may not be very familiar. This might all be quite new to you. A peer worker is, in the mental health context, are people with lived experience of mental health challenges and recovery who then intentionally use that experience to accompany other people through their recovery. And that definition came out of some discussions in the early days with sort of a small working group, and what came out of discussions was that the key parts of this definition are, firstly, when it comes to peer work, obviously the lived experience is crucial here. A person can't be a peer worker if they don't have that lived experience to draw upon. So that's one crucial part of this. The second part that's crucial in the definition is intentionally, that people intentionally use that experience. It's not just shared without thought or without sort of regard for who it's being shared with. There's a practice behind it all. And the final part we feel is really important in this, in the definition, is accompany. Because peer work isn't something that's done to people, it's something that's done with people, alongside them, that the people are active participants in their own recovery. So move on to the next slide. Excuse me. So that brings me on, finally, 10 minutes in, to the peer community, which is this new phase of the work. It's what's come after the PSP and the peer collaborative. So it's a part of the new Thrive work that's obviously all over Edinburgh. I'm sure lots of you here today are involved in Thrive, and Kat's going to be speaking to you a bit more about Thrive shortly, just in case you're not very familiar with what I'm talking about here. We decided to sort of so the work is now sort of being led on by the Peer Work Community of Practice Partnership, and that's a partnership between Health in Mind, so it's who I work for, and CAPS, who you met Jane and Victoria a bit earlier. They are here from CAPS today, as well as lots of other people here today. But the people who were part of that peer collaborative partnership in the earlier days are still here, are still sort of really active within the peer community, and are sort of part of the new steering group that's going to be guiding the work we'll be doing in the peer community over the next few years. And I'll be talking a bit more about that in the next slide. So one of the changes that's obviously been made is the name. We've changed the name slightly from peer collaborative to peer community. As much as I liked the old name, it wasn't always very clear to people that you're maybe a part of the peer collaborative by, coming along to the events. I think that was sometimes a source of confusion for people. So that was one of the decisions we made in the steering group, was to change it to peer community, but also to keep the old branding so that people who were involved before can recognise that we're still the same. It's a lot of the same people, it's the same approach, and that you're still welcome, obviously. And we sort of had a lot of discussions as well about how, we really want to build on the good work that's already been done, and maybe do some of the things that, didn't feel, sorry, my cat is just getting in the way there, and being able to build on the good work that's already been done, and maybe look at some of the things that didn't feel possible 2.5 years ago, but now this great groundwork has been done, that they might feel more possible in, for peer practice now in Edinburgh, and being able to look at those new opportunities and build on what's gone before. So I think this is my last slide. This is just so you can sort of see where you fit into this peer community and who the peer community is. So the peer community itself, you can sort of see, is there in the outer blob, and the peer community is made up of peer workers, so people in sort of paid peer roles, peer volunteers, informal peer supporters, also professionals who might be interested in intentional use of lived experience to aid recovery, but who maybe aren't specifically in a peer role themselves. And the community focus is on mental health, but we do obviously also welcome peers from, there are other adjacent practices that use peer practice, sort of such as addictions recovery, domestic abuse survivors, carers and homelessness, and obviously sort of peer practitioners from those areas are also very, very welcome in the peer community and are a part of the peer community. Sort of a bit more, sort of going inwards a little bit, we've got the peer community steering group, which I mentioned in the previous slide. So the steering group is, and at the moment the steering group is made up of the people that have been involved over the last few years, been part of the partnership over the last few years, to sort of get us started in these in the sort of early days of this new phase. And the steering group is there to provide direction and focus to the peer community implementation group, which I'll come on to in a sec. But I just wanted to say about the steering group is that it is open to you. Like, if you'd like to be more involved in steering the direction of the peer community, you're very welcome. And I will include some details on how people can come along to the steering group in the follow-up email to this event today. And then there's also the implementation group, which is sort of Health in Mind, myself, Alison, Jane and Victoria, so Health in Mind and CAPS, and we're there to sort of take what the steering group put together and basically make it work, and make it something that the peer community can use and come along to and benefit from. And I put some examples of the sorts of events you can and activities you can expect over the next few years. But obviously a part of today is, most of today is that we want to hear from you. We want to hear what you want, what you think's important, what you think's helpful, where you think the gaps are. That's why we've got, you know, lots of time later to have these conversations and to hear from you all. But you've heard a lot from me. I'm starting to lose my voice now. So I'm gonna, Kat, you might need to find your mute button and unmute yourself. I'm going to mute myself.
Hello.
So there you go.
So hi there, everyone. It's brilliant to see so many people, and I think it's just testament to how important peer work is for across our city. So I'm Kat Young. I work at Edinburgh Health Social Care Partnership, and I'm part of the Thrive team, which is absolutely brilliant because we do so much amazing stuff. I think I've got a colleague of mine online as well, Emma Gall. So welcome, Emma. So I'm going to be very brief actually, and just give you a kind of background to where this has all come from in terms of our kind of strategic direction. So this is our Thrive on a Page, which is our mental health strategy for Edinburgh Health and Social Care Partnership. I just want to point down to the 6 work streams at the bottom. So the peer collaborative sits within help when needed work stream. However, as we're talking about peer support, it could go into any of these work streams which are at the bottom. So let's not lose sight of that, thinking about building our resilient communities, thinking about a place to live, how peer support can really help. In fact, we've got peers within that work stream already as well. Closing our inequalities gaps, thinking about rights in mind for people and human rights, which is coming kind of right up the scale in terms of reports that are coming out, and meeting the treatment gaps. But currently this work stream does sit within help when needed, and it's, yeah. So moving on to the next slide. So our Thrive values, everything, all the service and supports that we deliver, which on behalf of Thrive, are underpinned by shared values. And this is a list of the values. Now we'll share the slides after this this event. However, I just wanted to go through them. It's really important that we're all kind of aware of them, even though our practice may be different, that everything that we do, our values, they're really underpinning everything that we do. We make shared decisions and value people's skills and experiences. We always work collaboratively with flattened hierarchy. We always build trust and foster empathic and honest relationships. We're always person-centered, and we'll give an example of exactly how that comes into realism, kind of with our Thrive Welcome teams. We show kindness and compassion and treat people with respect and dignity. We always start with people's strengths and build on these. We always engage people as citizens in their community and embrace the whole person. We give permission to try new things and adapt and learn, which I think the community of practice, you know, it's a great example of where we can do that even more. We deeply believe in our people are our greatest assets. So these are our values. So everything that we do are underpinned by these. So a bit of about the outcomes, you know, through the phasing of developing the public social partnership, we really went out and asked people what it was that was important to them, what were the main outcomes that we needed to see happening. So people have choice and control. People are recovering, staying well, and can live in life that they want to lead. People feel connected and have positive relationships. People are living in settled accommodation of their choice where they feel safe and secure. People have opportunities to learn and work and volunteer, and people receive good quality person-centered help and support. So we have measurement. We've currently got we've got an evaluation framework which we've set up as part of Thrive, which measures these in terms of both qualitative, and that's listening to people's stories and listening to feedback, as well as quantitative. So that's our data that's coming through. So moving on to the systems and financial outcomes. So these are the kind of wider system outcomes. So we're thinking about measurements of presentations at A&E and GPs. That's how we kind of assess these. So it's kind of timely access to high quality person-centered help and support, reduced levels of mental health and emotional distress in our communities, and reduction in unplanned and crisis health. And social care utilisation. So these are our kind of outcomes. So, and we've got measurement tools in place for these. So our ask as part of the kind of specifications was to develop a peer community of practice as part of the Thrive Collective, to create a community of practice to support development of peer workers and peer workers across the city. It's been an ambition of ours for the last 4 years, since I don't know if some of you were at the brilliant event up at the Melting Pot, where we developed a kind of a report, and that was with Mike Thinktastic. So that was great. So this is following on from that. So I'm going to hand over to Hayley to go through the ambitions, because I think that through the work we've been doing with the collaborative, we can see how we can even grow these things, and we can move them on even further. So Hayley, I'll pass over to you to go through these.
So the ambition for Thrive is for peer support, and through us, the peer community, is for peer support to provide an alternative type of support where people engage in non-judgmental, authentic, trusting relationship, where the peer uses their own experience to listen and guide people to help. So obviously there's sort of the peers sitting within the welcome teams already, and there's lots of peer support sort of groups through lots of different organisations, and some run independently as well in the city. But we're really hoping to grow those, and to be able to sort of bring those peers who are providing that type of support together to have conversations and make sure, you know, that we're all on the same page, that we're delivering sort of quality support for people to be able to access. So we want to ensure peer support becomes an integral feature of our health and social care support and services, and want to embed it across the system. So I think that's where Kat was speaking about earlier, in one of the earlier slides, that it's not just sort of in our work stream that we want to see and grow peer support. You know, we'd like to see peer support, you know, used in lots of different ways, for people to be creative, for it to be a sort of go-to option for people when they needed a bit of extra support in their lives. So we want to create a community of practice to support the professional development of paid peer workers in the city, and enhance opportunities for peer volunteering, and contribute to the Learn programme, which Learn programme is part of CAPS's work, if just in case you're not aware. So obviously that's, you know, a massive focus for the peer community over the next few years. He's been able to achieve that. And finally, to identify and action opportunities for sharing learning, training, giving consideration to building capacity in our paid and volunteer peer support across Edinburgh. And for that last point, that's really where we want to hear from you today, is, you know, it'd be really helpful to hear what learning's needed, what training would be helpful. You know, start thinking, if you haven't been thinking about that already, I would start thinking about it now, because you'll be asked it in the last part of today.
Hayley, you're on mute.
Ooh, so I'm just trying to go to the next slide. I will hand back over to Kat. There we go.
Brilliant, thanks Hayley. Yeah, so just putting that in context a wee bit, that we want to be creative here. We want to think ideas out of the box. Do you know, nothing's wrong here, because we have got Thrive, we've got peer work kind of sitting within our whole system. So this is a diagram that's from the Thrive welcome teams that we're prototyping currently throughout the city. But we've got peer work right at the centre around the person. So you can see the person's in the centre of this diagram, but we've got the team round about. And I'm sure that there's some of the Thrive welcome team members here today, but we've got peer work right there. But we also want to see peer work. We've also got peer work round in the Thrive Collective, with health in mind in there, with learning spaces. But we also want to see where else can peer work go, and not in just terms of this model, but in terms of all the different work streams as well, in terms of workplaces, in terms of, do you know, just we've got the Thrive line as well that we do, which is places of well-being throughout our city. So thinking about different places where people might be that we can put peer work to support people in our communities. So please just be as creative and as open with your ideas as possible. We're hearing you, and it's going to be taken away and put into actions for the community of practice. And yeah, we just want it to thrive, to tell you the truth, to be tacky and use the word thrive. So yeah. So this is my final slide that we're moving on to, and this is me and my bit of self-indulgent, because it's going to be my year of self-kindness, I've decided. And this is just a photograph from my home island. But I think that this photograph for me shows how, you know, we can really support one another when we find kind of similarities and stop ourselves from kind of flowing away into the Atlantic Sea. So that was just my little bit of self-indulgence in the arts, but also to advertise that we've got the Thrive Arts small grants out now. So if you're interested in doing art throughout the year, and as part of Scottish Mental Health Arts Festival or as part of Thrive Arts, please email Pam or myself or Hayley, and we can pass you on details around about these small grants. So that's me. I hope that I haven't bored you. Any questions you have, please put in the chat. Happy to answer them. Okay, thank you. Have
Thanks,
a good
everybody.
day.